In this video, we will demonstrate the basics of performing a microneedling procedure. Microneedling is very effective for improving the appearance of aging, fine lines and wrinkles, hyperpigmentation, acne scarring, and stretch marks. Combined with growth factor serums, the results of microneedling are even more impressive. When combined with our hair growth serum, microneedling can also help to regrow hair. As microneedling is safe for all skin types, it is an excellent alternative to laser treatments, chemical peels, and microdermabrasion for darker skin types that are prone to hyperpigmentation. This video is a demonstration of a full face treatment, as this is the most commonly requested procedure. Start by having the patient thoroughly wash their face with a mild cleanser and pat dry. If anesthetic ointment such as lidocaine is desired, apply and then wash the face after enough time has passed for the anesthetic to fully activate. It is important to wash thoroughly, as any anesthetic left on the face will form a physical barrier that makes it difficult for the microneedling solution to penetrate. We will start by selecting our needle tip. Unwrap the tip from its sterile wrapping and attach the head to the device by tightly gripping the sides and pushing it onto the end of the pen. Prepare the first section of the face by cleaning with alcohol. Typically, we divide the face into 5 sections, each to be done separately. The left half of the forehead, including around the outside of the eye, the left cheek, including the left side of the nose and upper lip, the corresponding 2 sections on the right side of the face, and lastly, the chin. After cleaning with alcohol, apply the microneedling solution to the section that has been cleaned. By applying the microneedling solution ahead of time, we are allowing it to be introduced into the skin by the microneedling technique. Turn on the device, selecting the desired speed. In general, the higher speed is the one to use once you've done several procedures and you feel more comfortable. Higher speed means more microchannels per minute, as well as less discomfort, as there is less resistance from the skin to the needles. You will want to make sure that you are holding the pen perpendicular to the skin. If the pen is not held at a right angle, only the tips of the needles will penetrate the skin, and the procedure will be much less effective. Go over each area with an up and down, light stamping motion, barely touching the skin. Do not drag or slide the needles horizontally across the skin. Dragging will create a cat scratch effect that will lead to more discomfort, more irritation, longer downtime, and a higher risk of hyperpigmentation, especially for darker skin types. Patients may also report a hooking sensation with this sliding method. Using a stamping method will create true vertical microchannels with no excess discomfort or irritation. The immediate reaction to microneedling varies from person to person, so there is no standard effect. Minimal inflammation to a deep red flush with pinpoint bleeding are normal variations. Factors such as skin type, needle length, and aggressive treatments will affect the results. Very little tissue reaction at the time of the procedure does not indicate ineffectiveness, nor does redness or bleeding indicate a negative reaction. Note that in this case, the patient has very little immediate physical reaction to the procedure. Once an area is treated, apply the microneedling solution to the treated area again. If pinpoint bleeding occurs during microneedling, blotting lightly with a gauze pad first will make it much easier to apply the serum. Applying the serum directly after microneedling allows you to take advantage of the open microchannels into the skin, which will increase the effectiveness of the serum. With the left side of the forehead complete, we will now move on to the right side. Start by cleaning the area with a new alcohol prep pad. Again, apply the microneedling solution to the entire area to be treated. Applying the solution one section at a time enables it to be more effectively introduced into the skin. We recommend 2 passes at a 50% overlap pattern. With a 75% or higher overlap, only 1 pass is necessary. Doing more than the required number of passes is safe and can yield even better results, but will likely result in longer downtime. Use your secondary hand to stabilize the skin by pulling it taut, as well as to move it laterally over bony prominences such as around the eyes to help with a more uniform penetration of the needles in these areas. Using your other hand over the face is also effective in allowing you to feel the vibrations of the pen touching the face. To accurately gauge how hard you are pressing with the pen, you can listen to the change in the pitch of the sound of the machine as well as the vibrations you are feeling. It is important that nothing besides the microneedling solution comes in contact with the skin after the procedure. The microchannels that have been created will remain open for at least 30 minutes after the procedure, so anything that comes in contact with the treated areas during this time needs to be sterile and made for placement into the skin. Makeup, sunscreens, and moisturizers can be applied after 90 minutes, but no sooner. If the patient is uncomfortable, a compress of cool, sterile water is safe to use. Discomfort from microneedling tends to pass within a few minutes. After the procedure, typically a quarter to a half of the microneedling solution will still be left in the vial. Give the vial to the patient with instructions to reapply to all the treated areas every 30 minutes until the vial is empty. Your patient should not apply any other products to their face until after the vial is finished. The microneedling solution and the needle heads are single-use only and should never be reused with another patient. The downtime associated with microneedling will vary greatly. There can be very little reaction, or they can have moderate to heavy redness and pinpoint scabbing that can last for several days. Microneedling treatments can be scheduled every 3 to 4 weeks as needed. To achieve the maximum benefit of this procedure, patients should apply our home-use growth factor serums twice daily. ProCell Therapies serum, labeled 1, should be applied first, and the accelerator, labeled 2, can be applied immediately after. There is enough serum in each bottle to last at least 1 month and frequently will last much longer. The ProCell accelerator also acts as a moisturizer, but if additional moisturization is required, it can be applied afterwards. Opening microchannels into the skin can greatly increase transepidermal water loss, therefore dry skin is a common side effect of microneedling. Let your patient know the importance of using a daily facial moisturizer after their treatment to prevent this. This concludes the training video segment for your new ProCell pen. You can find additional resources at www.procelltherapies.com or contact your local representative with any additional questions. Congratulations, and welcome to the ProCell family.